During pregnancy, it's important to be mindful of the foods you consume to ensure the health and safety of both you and your baby. Certain foods can pose risks of foodborne illnesses or contain substances that may be harmful during pregnancy. Here are some foods to avoid or limit during pregnancy. Raw or undercooked meat, poultry, and seafood. These foods can potentially contain harmful bacteria, such as Salmonella, E. coli, or Listeria. Make sure that all meats are cooked thoroughly to kill any bacteria. Raw or undercooked eggs. Avoid consuming raw or partially cooked eggs as they may contain Salmonella bacteria. Ensure that eggs are fully cooked until the yolk and white are firm. Unpasteurized dairy products. Unpasteurized milk and cheeses made from unpasteurized milk, such as soft cheeses like brie, camembert, feta, blue cheese, and unpasteurized goat cheese, can contain Listeria bacteria. Opt for pasteurized dairy products instead. Raw or undercooked fish and seafood. Raw or undercooked fish, shellfish, and sushi should be avoided due to the risk of bacteria, viruses, or parasites. Cook seafood thoroughly to ensure safety. High mercury fish. Certain fish can contain high levels of mercury, which can be harmful to the developing fetus. Avoid shark, swordfish, king mackerel, and tilefish. Limit consumption of albacore tuna and other types of tuna to no more than 6 ounces per week. Raw sprouts. Raw sprouts, including alfalfa, clover, mung bean, and radish sprouts, can harbor bacteria like Salmonella or E. coli. It's best to cook sprouts thoroughly before consumption. Deli meats and hot dogs. These products may be contaminated with Listeria bacteria. If you choose to consume them, ensure they are reheated until steaming hot to kill any potential bacteria. Certain fish with high levels of environmental contaminants. Fish like tilefish, shark, swordfish, and some types of tuna can contain high levels of environmental contaminants like mercury or polychlorinated biphenyls, PCBs. Opt for low-mercury alternatives such as salmon, trout, and sardines. Alcohol. It's recommended to avoid alcohol completely during pregnancy as it can cause fetal alcohol spectrum disorders and other developmental issues. Excess caffeine. High caffeine intake has been associated with an increased risk of miscarriage. Limit your caffeine intake to 200 mg, about 1 12-ounce cup of coffee, per day. Additionally, it's important to practice good food hygiene, such as washing fruits and vegetables thoroughly, avoiding cross-contamination, and storing perishable foods properly to reduce the risk of foodborne illnesses. It's always a good idea to consult with your healthcare provider or a registered dietitian for personalized advice and recommendations on a healthy diet during pregnancy. They can provide specific guidance based on your individual needs and any existing medical conditions.